In medicine, it takes about 18 to 20 years from when new research comes out for it to become the standard of care. And that's key information because a lot of times practitioners out there are just going to reflexively give you old information when the science has changed.
You mentioned something earlier about bowel health and pelvic pain. How are they associated? Because we're sort of going down the different paths. And the bowel health, I don't get it. Like, how could that be related to pelvic health?
As I sort of mentioned earlier, the vagina and rectum, right, and uterus and like anus, they're all in a very similar sort of tight spot down there. And so there's a direct impact on bowel health and pelvic floor health. You can imagine if you think of it like a pressure system, right? It's kind of the plumbing of the body. It is the plumbing of the body, right? And if you, let's say, become constipated, which is a major issue, for example, in this country, if your bowels are impacted, that puts pressure on top of your bladder and the pelvic floor muscles. Already that becomes a problem because now you've added weight to that delicate hammock-like muscles. And then if you are somebody that has to strain when having a bowel movement, you can just almost imagine now from your pelvic floor muscles perspective, if I am getting beared down and straining every day or many times year after year, that really creates an unhappy environment for those muscles. And that leads to something often known as prolapse, which is like a heaviness or falling or organs sort of kind of coming out in the more extreme cases. And so learning how that bowel and keeping, your gut happy and your bowels healthy and how to have a bowel movement, which is really relaxing and not holding your breath and bearing down, is really creating a much happier environment for those pelvic floor muscles. So that is kind of like in a nutshell how bowels and bladder really are tied together. And so it's really important to have everything be healthy down there.
The key point I'm taking away here is instead of straining in either bowel or urination, it's just to kind of keeping it calm, breathing in and out. How often nowadays we're working from home or we're managing 50 million tasks, and having to use the bathroom is where we give the shortest amount of time, right? We give this timeline of like, I just got a minute to go and use the restroom and I got to get back. And I have a feeling that's where we are training our bodies to just basically strain, push, complete, urinating or not, you have to get to the other task. But we don't do that when it comes to a lot of other things, when we're giving to others, when we're taking care of our child, when we're trying to read a book to them at night. But this few moments during the day, and it seems like we don't have to go often and holding for a while. But I can't believe that I'm saying this, but nowadays we're going to have to even create mindfulness in when we have to, let go of some parts of our body and, just basically having bowel movement or urination. We have to carve out time. It's just crazy to me, but this is where we're going, and mindfulness in a variety of areas. And I'm blown away by this conversation that this is not what we're having the time.
I think awareness is key. And I think in understanding, one of the first questions we ask is, how are your bowel movements? Because it has a direct effect on your pelvic floor muscles. And it's an easy place to start getting on top of constipation and improving gut and bowel health. So directly connected.
So talking about perimenopause now as women. So when can perimenopause sneak up on you, and how does it help or challenge some of our health that's associated with pelvic floor and variety of other changes that are happening in our body?
Yeah, so I'm really glad you brought this up because perimenopause and menopause is, again, a huge milestone in a woman's life. And I would say just recently, in the last few years, it has changed. I think the awareness and menopause is having a moment right now. And I'm really excited that it is because the science that happened about 20 years ago, the PR is that it's scary and that it creates or causes breast cancer or heart disease. There's just a lot of misinformation and scary feelings out there around hormone replacement therapy and when it happens and what it is. And let's start talking about it and breaking this down right now. But essentially, perimenopause is the period of life in which your body starts to change. It's considered a second puberty or a second spring now, which is, I like that term even more. And that is when your hormones in a woman's life really start to change. And I actually want to say, for the most part, estrogen plummets, which is very different than a man who, when they kind of have their menopause, it is just a very shallow decrease, which is ours. And I'm like, if you were watching me right now, I'm showing it's like a cliff, right? Going off the hill. And in fact, there's a bunch other hormone changes that happens as well with progesterone and testosterone. And it's called the zone of hormonal chaos. And what's interesting about perimenopause is one could argue it's more important than menopause, which is actually, menopause is one day in your life. It's a point in time. It is 12 consecutive months of not having a period. Then that day comes, that's menopause, and the next day you're postmenopausal. So really, perimenopause is where all the action is happening and where we need to be more aware and how not to suffer. And then to also be aware of all of the new research that has come out, which has really shown that hormone replacement therapy, the way it's given today, is the gold treatment. No woman should be suffering. And what I want women to know now is to educate themselves. I can provide a whole list, and you can put this in the chat comments or the notes area, where the science has changed and there's no more scary feelings about even estrogen cream. Let's say, so what's more common than hot flashes is actually dry vagina. I'm just going to throw it out there. So 80% of women have irritation, dryness down there, and an estrogen cream is 100% safe. And not enough women know about that, right? And it turns out now that estrogen, think of it almost like a gas tank. And who wants to drive without any gas in the gas tank? And estrogen therapy now, which is, it used to be given in a pill form, and now it's actually more like subdermal. So it's either as a patch or a gel or a cream. And it has been life-changing. And it turns out that perimenopause, so the average age of menopause, which we just talked about, is 1 day. And that's 51 years old, right? That's the average age. But symptoms can be developed up to 10 years earlier, a decade beforehand. And these symptoms, oh my goodness, there's 100 of them. And a lot of times, like you kind of mentioned this, we've been mislabeling it. We've been misdiagnosing it. I'm having anxiety or stress. Let's give you an SSRI. When it turns out it might have just been a hormonal imbalance. And we talked about dry vagina or painful intercourse, GSM, the genitourinary symptoms of menopause, and that's urinary tract infections and urge incontinence. Hormone balance is key. And for a lot of times, we used to think, oh, you need a blood test to diagnose it. But it's actually not the case, because every day your blood hormones will be different because it's based on a cycle. So it's not really typically the best way to diagnose it. It's typically based on your age, right? So we talked about it, the average age is 51. You can have symptoms definitely as early as 41. But if your menopause is 45, then 35, you could potentially be in perimenopause, which is a kind of another mind-blowing number. And the key with all of this information is that you just want to go to somebody who is a menopause specialist or who is up to date in menopause research, because in medicine, it takes about 18 to 20 years from when new research comes out for it to become the standard of care. And that's key information, because a lot of times practitioners out there are just going to reflexively give you old information when the science has changed. So my PSA to all women out there is to educate yourself. And again, go back to those notes that Yogi Patel is going to give you, and also to go to somebody who is menopause knowledgeable. Because again, we could talk about perimenopause and menopause for multiple hours, but that I would say is the key information that I want people to walk away with.
Thank you, Dr. Goodrich. You are listening to Now What podcast with Yogi Patel. If you like the content that you've heard so far, don't forget to follow, and please look at the description for all the details Dr. Goodrich has spoken about. And continuing on, one thing that you said, Dr. Goodrich, is perimenopause. So you could start at 35 and the symptoms. I had no idea that it can just vary, and then that 1 year mark of not having a period, and then that next day you are now finishes post-menopause.
Yeah.
These small terms, this is just one small conversation, less than an hour we've spent together. We've learned so much about women's health, pelvic floor, strengthening it. If you like the content of this video, please don't forget to follow. And also, if you want more information, visit the website, yogipateltte.com.